It was really hard. I cannot just tell you that. I remember this lady saw me in the hospital and asked me, I have just one kid going through this pain. How are you doing with two kids with sickle cell? I believe that I'm always been that strong mom and love those kids with all my heart.
Welcome to the show. I am your host, Anyoh Fombad, and I spark the hard conversations that challenge questionable cultural and societal norms that threaten the well-being of the African community. And I also share stories about growing up as Africans in Africa and in the diaspora. I strongly believe that normalizing open discussions and sharing experiences, whether good or bad, will not only make you find your voice, but will broaden your sense of purpose and empower others to do the same. So if you have ever tried challenging certain African cultural and societal doctrines, or if you have ever felt like it is about time that we confronted these issues in our African community and do better as a people, or even if you have always been interested in learning about the experiences of other Africans growing up in Africa and the diaspora, then you are in the right place. Welcome to Living African. Hello everyone, welcome to another episode of Living African. Today we will continue our conversation on sickle cell, and we will approach this topic from a different perspective, which is in regards to normalizing blood donation in Africa. So I have two guests here who will be talking to us, and they will really shed more light regarding sickle cell from a different perspective. So I have here with me Mrs. Zita Fomafung and Mrs. Charlotte. I just want to welcome you guys here. How are you guys doing?
Very good. Welcome to having us.
Thank you. So I would just start with a brief introduction. I would like for you guys to let the listeners know who you are and what you do. So I'll start with Ms. Zita.
Hi. Well, thank you for having me on your podcast. My name is Zita Fomafung. I am a CPA by profession, which is actually a certified public accountant for those who don't know what CPA means. And overall, I view myself as a solution seeker.
Right.
So I'm a serial entrepreneur, hobbyist, if you want to call it that way. And I just, with my latest business, which is Bojongo CPAs, where I provide a wide host of services in the DFW area, so in the Dallas-Fort Worth area. Well, I have several passion projects, and I'm going to speak mostly about Lifeline Africa, which is why I'm actually on the podcast. That's a non-for-profit organization that I founded in 2018, and it's really about educating and sensitizing the population in Cameroon about the importance of blood donation. So I'll just leave that introduction at that, and yes.
Right. Thank you so much, Ms. Zita. I am so happy to have you on here, and I really look forward to learning more about what you do, especially. Now to Ms. Charlotte, can you please introduce yourself?
Okay, my name is Charlotte Tcheudji. I'm a mother of 5. My goal is always just to talk about sickle cell. I had 5 kids, and 2 were sickle cell, and they both have bone marrow transplant, which was a fortune to me because having those kids with sickle cell, I usually know the pain that parents are going, and I'm so glad to have me on your show.
Thank you so much. Thank you so much, Ms. Charlotte. So let's just cut straight to the chase. So I'll start with you, Ms. Charlotte, because I'm really interested in your story about, your encounter with sickle cell. So can you tell us about how you came to know about, your kids having sickle cell? And did you know about any risks factors that maybe could lead to that prior to, when you had your children, maybe your status with your husband, and just your whole story with sickle cell?
Okay, I have a long story when it comes to sickle cell. And I have 3 kids before. There wasn't sickle cell. Before getting married, my status was I knew already I was AS by working already.
So that's a carrier.
Yeah, as a carrier. So I knew that I was AS. So when I found my gentleman and that was the first thing I asked him to do. And he did it. And he was AA, which was the best group. So I was, when I had first one, the second, the third one, I was just shocked to know that the fourth one was a sickle cell. So it blows my mind, but that's something that I never knew is going to happen, because I tried to protect that, to prevent that. But I believe that everything that happened with a reason, because that's the reason today that I can help kids with sickle cell. So I have the first one. I was blessed that one of the siblings was the donor. And the second one that had a bone marrow transplant didn't have a donor. But I was so fortunate to have a donor from Brazil who came and gave him the bone marrow and left. So I know the pain that parents are going through. And in 2000, my daughter who has a bone marrow transplant, that was in 2010. So I decided to create a foundation. So I was able to help kids with sickle cell back home. I'm lucky working in the hospital, so I have medical supplies that I take home. That was my goal. So, but that was what I was doing. I was giving this medication at Polyclinic Bonanjo. That was a big help, and kids with sickle cell was able to go there free of charge. But when Corona came and hit everything stopped. So I'm still helped to Lakentini. Sometimes when I have cases that they are not able to pay their bill, I make sure that I help the parents do that.
So thank you so much for sharing that. We will definitely go deeper into your experiences, in terms of seeking for treatment options with sickle cell and, of course, what you're doing to the community. So just to give a little insight to the perspective that we're coming from, especially with respect to the listeners. So Ms. Zita and Ms. Charlotte are originally from Cameroon. So when you hear certain names, you should know that these are specific places in the country of Cameroon, which is in West Africa. So now, Miss Charlotte, did you, was there a flaw somewhere with the sickle cell testing? Did you guys try to investigate what actually happened before, because, in order for you to have two full-blown sickle cell kids, there most likely will be an AS combination somewhere, So was it that there was a flaw or an issue that was, your husband was not correctly tested? Or did you guys try to look into the source or the cause of, your offspring having sickle cell?
I think the result that they gave me through my husband wasn't the right result, because they told me it was AA.
Right.
So he was tested in Douala. Mm-hmm. So I knew everything was okay until when that happened. So sometimes we have issue with testing in Cameroon, which sometimes we don't know how. It's so hard to get false results, and where the false result can take you into.
Right.
So that was the main issue. That's where everything started. And when they told me the first one was a sickle cell, I couldn't believe it. It's the third year that I have to go through many labs to confirm the test. So it was really hard, very difficult for parents to accept that.
Right. So thank you very much for sharing that. And it's rather unfortunate. And this also highlights the need for effective or rather efficient testing, and accurate testing as well, because this is a perfect example of how a simple flaw can literally affect an entire lifetime, So now, we got the bad news that 2 kids have sickle cell. Now, how was life for you taking care of these children? And, what has been your greatest challenge so far, and your fears, just experiencing life with these 2 children, raising them up and stuff like that? And how was your family also impacted by this?
I was impacted, but I have a lot of support from my husband first and my family. And I was just fortunate to be in this country with the last one that was born here, that was sickle cell, because the fact that we have free insurance here, it was a plus for that support. And she was always sick, but the good thing, she was, at any time I was able to take her to emergency room to have treatment. Mm-hmm. So those are the things that we have and we take for granted. And those back home, I feel the pain for those parents. When they are sick, they don't even have money to take them to the hospital. Mm-hmm. So that's the reason I decided to go back to my community and see what I can do to help those families.
Yeah. Yes. Right. Well, thank you so much for sharing that. Now, how was a typical episode like? Like, what are the symptoms that the children showed, which basically led you to know that, okay, we're going through an episode and we have to take this child to the hospital?
Mostly it's joint pain, kid with sickle cell. And when they are born around 1 year, they have like their hands, they swell, their feet are swelling, and they have a pain crisis, like pain that I don't think anybody can endure, because I remember when my daughter was 3 years, she was such a pain that she said, Mom, why? Why, God? It is so painful to see a little child, 3 years, talking to God. Why?
Yeah.
Asking that question was the most painful thing that I have in my life. And to see this little girl, she's 19 years, kicking life, being so strong, like nothing ever happened in her life. It's just amazing to see this little girl more than anything.
Right. I can only imagine. I mean, having a sick child is like every parent's worst nightmare, and greatest struggle, because you always wish like you could take the pain from them. You could help them in one way or the other. So I would only imagine, I mean, having two children who were always sick would probably even be so devastating. So how did you manage to be strong for them and to be strong for yourself and the family, and, just to make sure that at least regardless of what they're going through, you guys have some kind of internal strength and support for each other?
It was really hard. I cannot just tell you that. I remember this lady saw me in the hospital and asked me, I have just one kid going through this pain. How are you doing with two kids with sickle cell? I believe that I'm always been that strong mom and love those kids with all my heart, because when my daughter was having bone marrow transplant, my son was having a stroke. So it never been easy, but I believe that I have a strength that God have just given me a lot of strength going through all this situation, and seeing that son with a stroke at 12 years, having blood transfusion for 9 years, every 3 weeks. I don't know how I did it, but I believe somebody was doing it for me, and somebody is up there. So really, the strength that I always have, keep going, praying, and having courage. I never knew I can just be able to talk today about those kids, but it was so painful.
Yeah, you're definitely a strong woman, and thank God, thank you so much as well, for the strength, because I'm sure your kids definitely look up to you. I mean, now that you mentioned your son having a stroke, like, what other complications came with the sickle cell episodes?
With sickle cell, they have a lot of complications. They can have stroke, and the stroke can paralyze them, because I went the last meeting that I went home and I was with those kids with sickle cell. I have some kids that they couldn't talk because they had stroke. There are some that they are paralyzed, and there are some that it comes in many ways, because just the joint pain is, I don't know how to really explain it to you, but it's so painful to see those kids when they are in pain. So usually I talk to parents to give them a lot of fluid, a lot of water, to give love to those kids, because those kids they didn't ask to be what they are today, and give them love as much as they can. So they have a lot of complication. I had one in my hand now. All his feet are really bad, and I'm just trying to help him. So it's just one of the they have so many complications, and you don't know how if you're not strong enough, you are not able to handle it.
Wow, you must really be a strong woman, and I really want to commend you for that. Now, tell us about the blood transfusion and the bone marrow transplant that you had. I really want to hear about that story, about the donor story, and also I think you said your daughter had a blood transfusion and your son had a bone marrow transplant. Is that what you said?
No, both kids had bone marrow transplant.
Oh, okay.
But my son, before he had the bone marrow transplant, he had a stroke when he was 12. So when he had a stroke at 12, after 3 weeks, he was having blood transfusion. So he had the blood transfusion every 3 weeks for 9 years until he got a donor that was able to give him the bone marrow transplant to be able to be healed.
Wow.
Because I just imagine back home, if I was in Cameroon needing this blood every 3 weeks, where should I get this blood? Right. So when Zita started with that foundation, trying to get everyone to be a donor for blood, it was just one of the best things she did, because mostly those kids, they need blood all the time.
Right.
But sometimes they can't even afford it.
Right.
So both kids had the bone marrow transplant, but the blood transfusion was just the one that had a stroke when he was 12. So the first daughter that had a bone marrow, she was 8, and one of the siblings was the donor. So she's 19 now. My son, he had a stroke when he was 12, and he had a bone marrow when he was 21.
Right. Wow.
Yeah, so he didn't have any donor from the family, but we were so fortunate to have somebody a donor who came from Brazil to give him the bone marrow transplant.
So tell us about that. Like, how did they find the donor? Like, how did someone in a different continent, become a match? Okay,
we have this program everywhere to be a match. So everybody register so they can take donors from everywhere. So I think it's just something that be a match. I think it's a connection that everybody can be a donor. So you are tested, and when they find a match, so they try to communicate with the donor. And sometimes people don't even want to be the donor, but I was just fortunate because that one was able to work with us until he came here.
Wow, that's really amazing. I mean, that's definitely a combination of God's grace and just being fortunate, because not many people can have the same story. How have their lives been impacted by this bone marrow transplant, like in positive ways and negative ways as well?
Yeah, it's been just very wonderful, because my daughter, who has the bone marrow transplant when she was 8, she didn't have any complication, but my son had a bone marrow when he was 21. He had a lot of complications. So the bone graft sometimes wasn't holding, and he's been going through, but by the grace of God, he's doing great. He's doing fine. And I'm so just grateful to know that I was fortunate to have donors, because sometimes you really want that treatment, but if you don't have donors, you cannot have a bone marrow transplant.
Right.
So with those kids, I was just blessed to have those donors, and they have been doing good, going to school. The last one, as I told you, he's going through a lot of complications, but right now, by the grace of God, he's doing good.
Okay, perfect. That's really great to hear. So did they have any episodes at all after the bone marrow transplant, or they still have episodes, but it's very, very rare and also not as severe as before?
With the bone marrow transplant, it's the cure, so they are healed.
Wonderful.
Yeah.
That's great news.
They are not sickle cell anymore. They are just like you and I. So they are healthy, just like you and I, and they are just doing great. So they are not sick anymore. So
okay.
That's
really wonderful news, and I feel like this is something that will definitely help a lot of people. I mean, I haven't really looked much into the impact bone marrow transplant has on patients, but that's a very good thing to hear, and hopefully a good thing and a ray of hope to our listeners. So, I mean, I want to go back to the blood transfusion, and let's shed a little bit more light on the essence of blood transfusion. And I believe I would like for you, Zita, to come in at this point, and especially to highlight the things that you're doing, because I am very, very sure that, what you are doing is very rare and very impactful, especially to the community in Cameroon. So I wanted us to, just digress a little bit and focus on the importance of blood transfusion, especially within sickle cell patients, as well as the importance of blood donation. So just tell us about your organization and what you do and why you chose to start it.
So before I go into all that, I wanted to piggyback off of what Ms. Charlotte said about the foundation be a match and how powerful it is when hospitals are working with organizations like that to bridge the gap, right? So now with Lifeline is an organization I started in 2018. And the reason I started the organization, it really was from a personal experience. So my dad, we grew up in Douala, which is a city in Cameroon. Mm-hmm. And my dad was sick and he had some internal bleeding. So when he got to the hospital, my mom called me. I was like, "Oh, Dad is sick. He just lost some blood, and he needs a blood transfusion." And in my mind, and this was probably in 2018 when this happened. Mm-hmm. Early on in 2018. And in my mind, I'm like, oh, this should be an easy process, nothing. And I'm calling to get updates. Oh, we're still looking for the blood. I'm like, this blood that you are looking for, I don't understand. So they started explaining to me the process and all of that. And I was just blown away that in order for you to get the blood that you need, despite the fact that you have to pay up front for the cost of the blood, you have to provide 2 replacement donors for every bag. So if you need one, he needed 4 bags, so that means he needed 8 donors. My mom is an O negative, which is the universal donor, so she could give. By the time you count all your neighbors, you try to gather people here and there. Some people are available, some people are not available, some people don't want to donate. It puts a strain on the process and also delays. Right. So, cut a long story short, he wasn't transfused until probably about 9 hours later. And this is really good case scenario. Like, this is the best case scenario. And so that started the organization. My solution thinking hat kind of came on. I'm like, so how can we do it? And I started researching what's the process here in the US for blood donors. And I know Red Cross is constantly recruiting and things like that. So that's when I started work in Cameroon in 2019.
Right.
How I designed my program was to partner with the blood banks directly because I realized that one piece was missing: recruitment and management of the blood donor. So every time a donor came in contact with the blood bank, it was probably a family member that was sick, and there was no follow-up after that.
Right.
So that's how Lifeline started.
Yeah. Well, thank you so much. I mean, that's definitely a solution to a very obvious problem in the health system in Cameroon and probably in other African countries. And I mean, thank you so much for really demonstrating that value proposition of the organization and the services that you guys offer. Now, what are the steps that the team follows, you and the team follows, in terms of like the blood donation process? Like, how do you get people? How do you convince people? Because, I mean, maybe you probably have even a better understanding of, some of the superstitious beliefs that we have in Cameroon or Africa against like giving out your blood. People think, people want to give out blood to for rituals and stuff like that, So what process is like, what is the process and the steps that you guys take to first start by convincing people to donate blood and then also partnering with these organizations? And also I want you to also use your response to highlight the need for blood and the demand for blood in Cameroon.
Okay, so at a high level, the WHO requires a nation, 3% of the nation, to be voluntary blood donors in order to meet the demand. Cameroon is actually at 0.002% of that,
right?
In terms of benevolent donors. And then even just meeting the demand is another whole issue.
Right.
So there truly isn't blood in the blood banks. Like they're running on empty because replacement donors are not the best population pool. Because think about a family who has a brother or sister who is sick, they need blood right away, they're going to get it by any means necessary. So if it means paying somebody off the road to come give blood at the blood bank, that's what they're going to do. And statistics have shown that those are the worst types because the blood ends up being thrown away or discarded because the tests are not good, right? The test results, so they might be HIV positive or, there's contaminants in the blood because you're not getting quality. You're not going through the process of vetting the type of donor. Because if I volunteer, I want to come and give blood, I probably think that I'm of good health.
Yeah.
But if you're telling me that you're going to pay me $10 or $20, then my incentive is different.
Okay.
Benevolent donors are better quality. It's a better quality of blood, and so it's really the main focus for blood banks to have more benevolent donors than replacement donors. Mm-hmm. So how do we go about recruiting? Recruitment is actually very tough because one, the culture of donation, of volunteering, is not something that we have. Right? And so a lot of times the question is, for what? What am I getting in return? Why should I do it free when the blood bank is selling blood? So a lot of our strategies are education and also sensitization. Sensitization by telling personal stories too. People who have become benevolent repeat donors because maybe they saw the need, or a family member of theirs went through and needed blood and some random stranger came in to do that for them, and so that made them more sensitive to the needs of people who really need blood. So I would say that from a cultural perspective, even within the same country where we're in Douala and Yaoundé, it's also different.
Yeah.
In Douala, they have their own culture. Yaoundé has its own culture. And let's not even talk about the north. Yeah. That's a different culture. So every strategy, you have to develop different strategies for the different populations that you're trying to educate and sensitize about donating blood. Right. So we use a wide variety of ways to sensitize and educate the public. And a lot of it goes with partnerships with different like-minded organizations like, say, and Miss Charlotte's organization. That would be a good partnership where we partner with them and make the parents understand that you too could be, if you're not, I don't know if sickle cell is being tested in your blood for blood, but I don't know that that's a deterrent from becoming a blood donor. You can actually donate. And a lot of people are just not informed of like what makes you that you're eligible to donate, and there's really nothing wrong in giving your blood. The red blood cells die out and rebuild themselves every 120 days. So it's just a lot of education and trying to sensitize them to get a human feel to what they're doing and how it's saving a life.
Right. Amazing. Awesome. So I see sometimes on your social media, on your stories, you always share screenshots of like people that are asking for blood, and usually 10 out of 10 times it's literally an emergency, like life or death situation, and that really highlights the demand for blood in our country, in Cameroon, and maybe even in Africa as a whole. Now, how is that process when they, because they're not even supposed to be asking you directly. They should be asking the hospital, So like when that happens, like how is the process for you to make sure that they get the blood that they need?
Okay, so the future state of Lifeline, we really want to be at a place where we have a big pool of donors where when you call us and say you're in Edea or you're in Yaoundé and you need 2 donors, and we can call at least 20 people and maybe one person will show up, right? So that's the vision. But where we are now, we are still growing, we are still getting the donor pool. And so when we get SOS calls like that, we reach out to our groups, to our donor groups, and try to say, okay, there is an emergency at this hospital. Can you go donate? And there are people that will say, oh, what location? I am currently here, but it's going to take me 1 hour, 2 hours to get here. And we do get responses. Sometimes we don't. Sometimes some people are not disposed. But within our groups, we've seen that the willingness is there, but maybe they're caught up in other life activities that they cannot donate. So and with one of the cases, because I group the need into 3 categories. There is a group of people who don't have the finances to pay for the blood that they need, right? But maybe they have donors, maybe they have replacement donors. We have other people who don't have replacement donors but they have the finances to pay for the blood that they need.
Right.
And the blood that they need is available, right? That's another group. Then we have the third group where the blood that they need is not available. And so in that case, you're looking for a specific donor.
Right.
So you need B because you want that they should just get it from that person and give it to you to use. And so within those different categories, and every time that they reach out to our organization, I ask, I'm like, what exactly is your issue? Is the blood you need not available? And another challenge I've seen within the system is the banks are not talking to each other. You can be in Yaoundé and there are 10 blood banks and maybe 2 have the blood that you need, but you have to physically walk to all these 10 places to find it and find going, right? So we're also trying to get to a place where the more hospitals we partner with, we'll have more visibility and we can say,
network.
Yes, we have it here, come here, bring the 3 donors, or we can provide you with the 2 donors, they are available, and we go from there and reduce that time. We're hoping that we can bridge that time gap between when you actually get it.
Right. Yeah, I mean, that really highlights the need for also a kind of integrated health system. And that's actually what is being pushed for, especially here in America when it comes to value-based care, because it's all about improving the overall health outcomes of the patient through, offering value-based care, basically integrating the care process for the patients where the doctors and nurses, every member of the healthcare team, they collaborate and form a network where they can literally communicate easily, with each other to take care of that patient. So I feel like that's a very smart way to do it, to create that network between the different blood banks so that there should be that kind of connection, especially in Cameroon and in a lot of other countries. When you have 2 organizations or 2 businesses doing the same thing, they look at each other as competitors. But at some point, if, they come together for the, greater vision, for the greater good of the community, they both have the same mission, actually. But it's like they look at each other as competitors. And once we get rid of that, mentality, I feel like we would literally do a lot more in our communities.
Yes.
So that's such a good idea that you brought. Now, I would only imagine you guys face even more challenges because it's not easy to run such an organization, especially an organization where a lot of the people are still skeptical, a lot of the donors are still skeptical, and they want some incentivization, right? They want you to give them something for their blood, you know what I mean? So I would only imagine that funding has probably been an issue, especially for your organization, which is still like at its infant stage. So what are some of the issues that you face with the funding and, financial support that you receive?
That is a major challenge. For the past year, I have been self-funding, and also just for an integrity standpoint on my part, I wanted to be sure that this was the concept that could work, and this was something that the administration would be receptive of that. So I feel like I'm at a point where I have proven that it works and there is a need, and the population is not totally insensitive to the need of it. I just think they just need to be more educated, and the blood bank needs to be more transparent in their practices, right? So if the blood bank was perceived almost like a black hole, it's like, oh, you guys are drinking blood in there. People don't work at the blood bank, right? So demystifying the blood bank was found that it's such a great way to, and the power of word of mouth, right? So coming back to the financial, to the funding, it takes resources to plan campaigns. It takes resources to educate people. It takes resources to mobilize 1 or 2 people or bring them together, right? So we are encouraging any form of donations, be it in kind or in cash. We are looking to partner with anybody that can help us foster our mission. And I have been doing little fundraisings on social media, going to my website and doing a donation, but I am now planning bigger campaigns, fundraising campaigns, where we can raise money and bring more awareness as to what we're doing. One of the challenges with blood or hematology if I should call it an industry, is there's not a lot of direct funding. There's a lot of indirect ways to fund. A lot of the big organizations like the UN and things like that, they like to fund the government. and then the government will go ahead and do. They hardly, especially for organizations that are doing work in Africa, they don't directly want to fund those associations. And I may be wrong, and I'm open to getting more information about funding. This is a new territory for me as well, so I am learning, but it has been a challenge on finding ways to get funding and create programs that are mutually beneficial to funders as well as you, and where there's that mutual goal being accomplished, right? So that, I would say, has been the challenge that I have so far, is finding organizations that directly support the mission.
Right. Yeah, I would only imagine that to be one of the primary challenges, because at some point, without any kind of funding, you can't really do as much as you would like to. So I would definitely, for the listeners who are very interested in supporting this very, very important cause, I'm going to put both of the organizations in the show notes and also on the website for those who are interested in supporting. Now, talking about partnership, Miss Charlotte, I know that you had mentioned about your own organization and the help that you give to, especially to the sickle cell families back home in Cameroon. And I believe you're also one of the organizations that partner with the Lifeline organization, which, Zita has. So what other things do you do with your organization to help, families back home?
Okay, my organization, since I created this organization, things are not really going the way I wish, because I could have done a lot of things in Cameroon, but with the system, things are so just hard and difficult. I have the opportunity to take medical supplies back home, to which I can give to one of the hospital. I tried with Lakentini that have sickle cell center. It didn't really work the way I thought, because that was the good place to really focus, because that's where a lot of kids with sickle cell. Right. But it didn't work. So I tried Polyclinic Bonanjo. Things were going very so good, because we signed a contract for 2 years, and I have a sister back home that was recruiting, going to church, to school, to get those kids with sickle cell, and they will register. So when I go home with medical supplies, I will just give it to the clinic. So the clinic would take care, and she will issue them an ID. So each time when the child is sick, the parents would just take the child to Polyclinic Bonanjo, and they will get free treatment over there. But unfortunately, what happened was the COVID-19 that came, and the contract was disrupted. So right now, I face a lot of challenge when it comes to finances. What I do usually is just like, a fundraising with my community. In Oklahoma, they are very supportive. And right now, the medical supplies are there, but it's just a big challenge financially, but I still try to help as much as I can.
Well, thank you both for helping despite the hurdles. I mean, living in the United States and running an organization in Africa as a whole, or even in another country, is definitely challenging. And especially with, the other things that have been happening in the world so far with the COVID-19 pandemic and stuff like that, which has drastically slowed down processes and operations. I would only imagine the additional challenges that you guys, face. So I really want to thank you for being resilient and still sticking to your mission and your end goal of really making that impact in the community. Now, I want us to shift a little bit to raising awareness in the community, because in as much as we put in a lot of effort to, make that impact through blood donation, there's still a lot of hurdles that, we tend to face, or you guys tend to face in the community. And I feel like raising awareness and letting people understand certain things and the importance and the value of donating blood could definitely contribute towards that sensitization and helping to get people to act and give their blood, donate their blood. Now, I remember, Zita, when we were talking at one point, you were talking about a few instances where, you had family members with sickle cell patients, for example, and they were like looking for blood donors, like they're looking for blood when they didn't even know that they could actually donate the blood. I really want you to talk more about that, so that a lot of people, because I feel like there are a lot of people out there who can potentially be helpers, like in terms of donating blood, but they just don't have that initiative, to do it. So I really want you to shed more light on that to basically encourage people to give blood.
Yeah, so when I was in Cameroon for about 6 months, and during my time there, I participated in 2 of our major campaigns. And prior, in between campaigns, and even just staying there, I initiated several conversations with different people. And sometimes I spent a whole day at the blood bank, and I see people who are coming in because they're in need and stuff. And the perception I had for most people that came to the blood bank that were in need is they perceive donors to be some other person.
Yeah, some external person.
They seem to be, and you hear them, oh, I pray, let God send us a donor. And I'm like, have you tried? And they said you can't, or, is there maybe some medical reason why you cannot donate? And they're almost, the look on her face at the time was shocked. Like, I've not even thought about that. Right. And so I think we're trying to change the narrative to a donor could be you, it could be me.
Right.
It's not like some person from somewhere. I guess demystifying who a donor is.
Right.
Just anybody over the age of 18 that is in good health. And I always say, just go try. If they check your blood count and all that, and you're not eligible, they're not going to take it. They're going to let you know that you're not eligible. So those are some of the things. And also convincing somebody. I'm very passionate about this. And during the campaigns, I was handing out flyers. I was talking to people. I'm like, oh, it's just right there. Like,
a few steps away.
And I couldn't convince one person.
Wow.
I personally couldn't. One guy was like, look, I am not giving. He's like, I am not going to give. And that's the end of story. If I was in need, he was going to come give it on my behalf, but just to go give it for free, he's not going to give it. And when somebody tells you such a matter of fact way, it's like, and then I had another person tell me, they're never going to give blood because when they needed it, and when they needed blood because I think they were going into a pre-planned surgery or something like that. And so he had to have a certain amount of blood available. And he paid somebody to come give blood. He paid the person arrived, gave transport money. This is funny, it was not funny. Paid the person's transport, the person got there, said he's hungry, he needs to eat first. He fed the person, and when the person went in to go during the pre-screening, he's like, I have HIV.
Oh my goodness.
And so he's like, that experience, do I know how many people he paid to come in? He would never ever be a blood donor. And I was just like, okay, yeah, it's unfortunate you went through that situation, but like, this is so there's just a lot of work that needs to be done. When you think about it, it's quite overwhelming. There's the mentality, a lot of people's experiences when maybe they needed blood, and that's, we have to acknowledge that customer service is something that we struggle with, right? And with our training, when training with the blood bank staff, we make them understand that this caretaker of the patient that needs blood could be the potential donor.
Right.
So you have to be empathetic about how you treat them, because that person's bad experience at the blood bank goes to 10 people in your neighborhood, and those are 10 donors that you completely
lost. Yeah.
So now we're trying to put in those strategies in place, trying to make sure that, we receive those caretakers of the patients well, they have a good experience overall from a caretaker standpoint, and also from a donor standpoint. I'm like, a donor cannot come, put in all this effort to recruit somebody, they show up, and you say you're going home. You don't want to collect.
Right.
You know what I'm saying? So these are some of the things that, luckily we've been blessed, and I have turned down a hospital. I have walked into a hospital that contacted us to work with. And I just spoke with the management, and I saw that this was not going to work.
Right.
Because we need to be in alignment with where we're going.
Yeah.
You can't treat people a certain way and then you expect this same person to come back. They're not going to come back. The experience they have at the blood bank would determine if they're going to come back again to donate.
Yeah.
This is their time. This is their resources that they're taking to be here. Mm-hmm. So luckily with the hospitals that we're working with, they are very cognizant of that. The leadership is very proactive to pass down that culture within their staff. So overall, we are not where we want to be, but I think that we are going to get there. It's one step at a time.
Right. Wow. It must really be an experience, like dealing with all those things, through the organization. So I really want to commend you for that. And, at some point, it's like, regardless of what you tell people, they would just not be convinced. Like from your own example, they would just not be convinced to donate blood. So, but at least we need to start from somewhere, right? So with this question, I really want to get both of y'all's opinions on what you will tell the African community, especially regarding the importance of blood donation. So Miss Charlotte, I would want you to basically talk about that from a personal perspective, how blood donation has saved your kid's life, basically. I would want you to use your response from that approach to really highlight the importance of blood donation. And then Ms. Zita, I would also like for you to use your own experience through the organization to really let people know how lives have been changed through blood donation, just to highlight that importance of blood donation. So Charlotte, I'll let you go first.
Okay. The blood transfusion have changed my perspective about a lot of things that happened to my son that had a stroke when he was 12. So I cannot just imagine I was in Cameroon or in Africa needing that blood every 3 weeks for 9 years.
Wow.
So giving blood is just like giving bone marrow transplant. Be a donor. Because be a donor, you may be not the one that needs that blood or the bone marrow. Mm-hmm. You can save a lot of lives. Mm-hmm. Just imagine somebody that I never met, never knew in a country that I will maybe never go there. In Brazil, that offer, because he was a match to somebody that he never met, never talked to just come and give that bone marrow. So people need to understand that our mentality needs to change, because giving blood is just to save life. Yeah. I remember lately I sent my husband back home. That was in February. I sent him to random with 200,000 to see who he can really help at the clinic with the sickle cell at La Quintini. He arrived there. This man, he needed 2 bags of blood. He couldn't afford it. How much was it? 24,000 a bag. So he could have been just dead if he didn't have nobody, to give him that money to buy those bags of blood. Yeah. So giving blood is saving life. Yeah. It's saving life, because you don't have that blood, you can easily die. Right. Just the blood can kill you. So when you cannot offer to give that blood, it may be you tomorrow. You may need that blood tomorrow. But if you're not a donor, so I encourage everyone to give blood, because it's a lifesaver.
Wow. So, thank you so much. Thank you so much for that. What about you, Ms. Zita?
When we say give blood, it saves 3 lives. I remember I was talking to the head of the blood bank at one of the partner hospitals. I was like, what does that really mean? Give blood, save 3 lives. So he said every bag of blood can be fragmented into 3 different products: red blood cells, platelets, and plasma. Mm-hmm. And these can serve 3 different types of patients. And in Cameroon especially, a lot of the patients, I would say almost 40% is maternal during maternal deliveries and stuff. Actually, let me not quantify. Let me just say a majority is due to maternal during deliveries and things like that, bleeding during deliveries, pediatric anemia from malaria, and then people with blood disorders as well.
Yeah.
So then let's not talk about cancer patients who might be and things like that. So the need and accidents. Accidents actually is actually a big cause, and we have seen where in Cameroon there was an accident in Zita or something like that. I'm not calling it right. There was a train accident and there was massive lives lost and lots of people that were injured. And the city, the town mobilized. I mean, the blood banks could not even collect enough blood from people. So people came out to donate. So what am I trying to say? We have it in us to put ourselves aside, but it shouldn't only be in emergency or tragic situation. Right. And I think that we don't realize that the need for blood could really be anybody. You could have malaria and you become anemic and then you need to be transfused. Right. You can have a roadside accident and you need to be transfused. So you can be a donor. We can all be a donor. And when I talk about donations, I remember when I was in college here in the US, there was, I think Red Cross or something was on campus, and I was just curious. I was like, oh, what are they here for? And this is way before Lifeline even was the thing. And they told me, oh, blood, they're collecting blood. I'm like, interesting. Okay. So I'm filling out the form, and I was disqualified because I go to Africa.
Yeah.
So I wasn't qualified. But to say that, I'm just saying this to say that even us in the diaspora, we can be part of the solution. Yeah. We need to get into the mindset of donating. If we can, try and let them disqualify you, but don't just assume that you're not going to be, you're not going to qualify. Because I think even traveling to Africa, there is a timeline, maybe 5 years or something. If you haven't gone within 5 years, something like that, then you can donate. So I would say that we need to, and one question somebody asked me today in one of my other meetings was, how many of us, when we go to the DMV and they say be a donor or an organ donor, do we check that, right? So that gave me some pause. I was like, we need to check ourselves too sometimes. And we are getting a bone marrow transplant from somebody in Brazil. I'm sure if we call Be a Match and ask how many Africans are on their list, we will be surprised to see the numbers that they're not very reflective of the population size.
Right. That's very true.
So I think if we're expecting to be able to receive some of these services, then we should, and now I'm going to look more into bone marrow, maybe. Yeah.
That's very true. What you said was very true. I mean, even about donating blood here, I also had a similar experience as you. I mean, for that one, we had a class. It was a biology class or something, and to get extra credit, they encouraged you to go and donate blood. So I went, and I mean, I was just like fresh off the boat from Africa, and they were like, nope, you're not doing it, because I mean, they asked if I've had malaria. I'm like, yep. They're like, no, you can't do it. They're like, no, you can't do it, But I mean, things like that, I even felt it just made me think, like, what if it was even incorporated in schools, as a way to encourage people, to.
And so there are countries in Africa like Senegal, Ivory Coast, and even Ghana, whose blood banks operate 100% benevolent. Wow. And for these types of things to occur from a national standpoint, it takes collaboration at all levels. Yeah. From the Ministry of Public Health advocating for that to the Ministry of Education, everything needs to be synchronized. And within Lifeline, we have a program, it's an internship program, and it's Lifeline Educators program. And we just had a high school student, he's in the sciences and he wants to be a doctor, and he was interning, and he's just blown away with the knowledge about blood. Up until high school, he has never heard about blood or the need for it.
Wow, that's really good. I mean, that's an interesting story, actually. Yeah. And I mean, I just want to thank you guys for, you know, all of this, you know, different ideas that you have brought together and shared on the importance of, you know, blood donation, you know, because that will forever be something that is very, very important, because especially for us here in the diaspora, we shouldn't think that Africans don't need blood because we're going to need blood. I mean, I have had a blood transfusion or two in the past, you know, and I feel like, you know, you never know when you will need it. You know, just being a donor does not necessarily mean that you're never going to need, you're only helping someone, but you never know. There's also another donor out there who has given blood for you to use in the future. So you never know when you will need blood. So I feel like we need to also consider the fact that one day we're also going to be on the other side of the road and we may need that blood, you know. So it's always good for us to help others. So I just want to thank you guys for sharing all of these stories and insights with me. And I would definitely put your contact information in the show notes, you know, for all the listeners who want to support, who want to show support, or at least participate or contact you guys. I will put all of that in the show notes, you know, for you guys. So I really just want to thank you both for coming on here. And I really hope that, you know, this conversation does not end here. As I always say, I hope that we can all take these conversations and, you know, continue talking and continue sparking these conversations within our individual circles and our little communities, and see how we can come together to better our community as a whole, you know. And I just want to thank you guys again for coming on here, and I would see you guys in the next episode. Bye.
That's it for today. Thank you for listening to our show. If you want to participate in the show or find out more helpful resources, then visit www.livingafricanpodcast.com for more information, or email us at hello@livingafricanpodcast.com. Also, don't forget to connect with us on all social media platforms at Living African Podcast. You can also connect with Anyoh directly on Facebook or Instagram at Anyoh Fombad. Thanks again for listening, and let's not forget to be more understanding and nicer to one another.